All right, Sadie, just so you know as well, we, both Diana and I are advisors in the Health and Exercise Science Department. So, and we both live in kind of remote areas. I live on a ranch and Diana lives out in the country as well. So if we at any point in time lose connection with you or you can't hear us, send us a message on that text messaging, and then you can go right back in and join the meeting. We'll try and connect back up with you. Okay.
Okay.
All right. So we are the Health and Exercise Science Department at CSU. We're in the College of Health and Human Sciences. So we have a lot of students that are coming to CSU that are interested in our major because they want to work with people, they want to work with the sciences, and they want to work with potentially those disease processes and improving healthy aging. So in the Department of Health and Exercise Science, right now there are 5 academic success coordinators. We shorten that to ASCs. They stand for academic success coordinators. And again, Diana and I are 2 of the 5 in health and exercise science. There's we'll go over the agenda. We can kind of expand it or shorten it depending on what questions you might have, but we'll just go over some base information for you. Today's agenda, I'm going to talk about a couple of the things that really relate to advising and the structure of advising at CSU and specifically within health and exercise science. We're going to learn about the HES major. Why would you choose this major maybe over another major, and what would you do with this major in your career once you graduate? So we have 2 concentrations in HES, and Diana will be going over those in more detail. And then at the end of our presentation, our formal presentation, we'll have time to just do some questions and answers for you. And since you're the only one on the call right now, and you've already been doing online learning, you probably already know enough about Zoom etiquette. So you've got your microphone muted. I think we're going to be good for the rest of this presentation. So who are we? Again, there are 5 of us. And at this time, the role of an academic success coordinator is really to help students along their journey, not only within the academic side of things, but also career interests and moving you on to potential graduate schools and or career interests. So we right now split up advising within health and exercise science, since we're fairly large. We're usually one of the larger majors, very popular major at CSU. Right now we separate students by last name, just so that we have the ability to message all students to let you know when you might want to need to register for classes, and any other important messages from the advising side at CSU. So again, there are 5 of us, and for now, you're going to be working with myself. I have the end of the alphabet. I also work with some students D to K, and then Diana Kiker has the last names N through S. So when we talk about advising in general at CSU, we're really a unique structure of support for students at CSU and the community. So when we talk about those students who want to go to CSU, some students will potentially go to a different university and their structure may look different, but CSU's structure of advising is very unique. We actually meet with students in health and exercise science. You're required to meet with us at least once a semester up until the time you complete 60 credits. So that's up to 2 years at CSU. And what we help you do is not only help you with what courses to take and maybe talk about which of the concentrations you want to be in and what your career interests are, but really help you with those other things in terms of integrating at CSU once you get to campus. So if you're having difficulty in a specific class, where could you potentially get tutoring? If maybe you're sick and you need to go to see a doctor, being able to connect you with the CSU Health Resource Network. We're someone that you can be a sounding board for if you're having difficulty with a professor in a class. We're someone you can talk to confidentially help you sort things out and maybe approach things a little bit different. We can help you with time management, and really are your resource at CSU to get connected to student organizations and being involved on campus. So there's a couple things that I'll talk about on this slide. And I think one of the big things that ties into what we do in our role with health and exercise science is that we do work with about 1,000 to 1,200 students each year in health and exercise science. One of the unique things we have at CSU for health and exercise science majors is that we have a specific learning community at CSU, and a learning community is one where you are living in the residence halls with students that are the same major. You're eating, you're living, and you're studying with those students so that you have a kind of built-in study group, you have common interests. And that particular residence hall on campus is Corbett. And Corbett also happens to be right across the street from Moby Complex, which is where the varsity athletics, volleyball, basketball games are held. And it also is where the health and exercise science department is housed. So the advising suite is in the Moby B complex. So it's a really nice tie-in. So if you want to have that unique experience where you are in a learning community with like students, like-minded students, that's one really unique feature that we have at CSU and with the Department of Health and Exercise Science. So we are going to, when you choose health and exercise science, you're going to have a Bachelor of Science in Health and Exercise Science. But we like to say you get to choose your own adventure with health and exercise science. And these are based on a couple things, based on your academic, professional, and personal goals. We have 2 concentrations to choose from. So we have the sports medicine concentration, and the students that choose sports medicine are well prepared for health-related graduate programs. So if you're interested in going to medical school, if you're interested in going to school to be a nurse or a physical therapist or a chiropractor or a dentist, our concentration, sports medicine concentration, is designed for you to get the courses that are required in health and exercise science, as well as let you develop your guided electives to the school of your choice, whatever that is, occupational therapy or physical therapy or many of the health professions related fields. And our second concentration is called the health promotion concentration. And students who choose this are students who really want to know really the big sciences as well. Again, it's a Bachelor of Science. They're well prepared to go directly into the workforce after graduation. So we have 2 tracks, and even though you might choose health promotion concentration, you can still go to graduate school. So we don't really want to say you can't, but that's kind of the direction our students are going within those 2 concentrations.
All right, Sadie, I'm going to take over now and tell you a little bit more in-depth information about both of the concentrations. So I'll start with sports medicine. So what are the pros of choosing this over health promotion? Well, it is definitely the fastest way to meet all of the science prereqs that you're going to need for those health-related graduate school programs. And as Carrie mentioned, you know, they're listed below are some of the common graduate school options: your physical therapy, your occupational therapy, pre-med, physician assistant. A lot of the prereqs that you need are big science. It's chemistry, it's physics. And then we have some big science HES classes, exercise, you know, physiology, for example. So that's definitely, all of those big science classes are already in the curriculum. Another pro is that you're well prepared, right? Because all the prereqs are already incorporated into the curriculum. And within the sports medicine concentration, there are 10 what we call guided electives that you get to take, and you get to choose from a list. It's a set list. And so you will look at those based on your health-related career interest. And something else to think about when you choose the sports medicine concentration is you will have a secondary advisor to your HES ASC, and they are called a health professions advisor. And that's a separate office on campus. They're a team of 4, and you will get to know them. They do presentations in the summer when you come to orientation, and you will work with them to locate different graduate schools out there that you want to maybe go to. Also gaining clinical experience. That's another big piece of what they help you with. Because when you apply to PT school, it's not just about grades and having all the prereqs. It's also about knowing what does a physical therapist do, because that's how you find out if this is really what you want to do. So there's hours of clinical experience that are required, and they can help you find that clinical experience. So something else to consider when you choose the sports medicine concentration, there's not a lot of time left to volunteer to work a part-time job, because when you're taking big science classes, they have labs with them. So labs take up a lot of time. You know, most of these big science classes are 4 and 5 credits. So you're going to be spending, you know, quite a bit of time in the classroom. Another thing to think about is not a lot of flexibility for exploring other courses. And by this, I mean maybe getting a minor. I do have, you know, I think both Carrie and I would say that we do have a fair amount of our students that do have minors and other things. So maybe a popular minor for sports medicine would be, one that comes to mind for me is biomedical sciences. And minors are typically 21 credits. So if you can make that work, that's a good thing. Some of the classes that you do have to take for the sports medicine concentration are also classes that you have to take for a minor. So sometimes if you pick a minor that is like that, then it's not, you know, such an inconvenience, and it's easy to work into your schedule. But yeah, so sports medicine is great if, number one, you love science, because there's 3 chemistry classes that you're going to be taking: Gen Chem 1, Gen Chem 2, and then there's organic chemistry. And there's a really cool class that you get to take called Human Gross Anatomy, where you get to work with cadavers. And CSU has a fairly new cadaver lab. And I think they have about 24 cadavers that students work with. So there's maybe only 4 students per cadaver. So it's a great way to learn about the human body. All right, so what's health promotion all about? Well, health promotion has a lot of practical experience built into it. And what I mean by that is there are 2 practicums, and a practicum is part classroom, part hands-on out in the field. And then there's a required internship at the end. And that internship is worth 12 credits. And that is the very last thing that you do before you graduate. It is your last semester. All your coursework has to be done. And the internship can be done anywhere in the United States. And the first practicum is done on campus. So you're going to be working with clients that are average age 65 to 70. And then your second practicum, you'll work with Dr. Wendy DeYoung. She is the concentration director for health promotion. You'll work with her based on your area of interest, and she will help place you. Could be on campus or it could be off campus, but it would be in the local area of Fort Collins. And then your internship, you will also work with Dr. Wendy DeYoung to find your internship. So that's the practical experience that you gain, which is amazing, because if you have no intention of going on to graduate school, you can put this category of all this great experience on your resume, and it helps you find that first full-time job. And a lot of our students do get hired from their internships. And that's the whole goal of doing an internship, is to gain experience and to possibly get hired. Another pro of the health promotion concentration is there is more flexibility with course selections and minors. Health promotion, you know, still has some big science to it, but definitely not as much. And a lot of students that choose the health promotion concentration, they do get a minor. Business administration is a pretty popular minor, because there are a couple classes that you take that go towards that minor. And then just taking outside classes of interest. So other things to consider with the health promotion concentration, you can choose this concentration if you want to go to graduate school, but you will definitely have to work back in some of the big science prerequisites. One thing that comes to mind for me is with health promotion, there's only 1 chemistry class that's required. So for example, if you wanted to be a physical therapist, you could choose health promotion, but you would have to work back in 2 more chemistry classes. And probably, you know, there's a couple of physics that you're going to have to add in, etc. But it can be done. And in my caseload, I do have a couple students that do want to be physical therapists, and they did choose health promotion. Another thing to think about with health promotion is it's very highly sequenced. And what we mean is you have to take this class before you do that class and so forth. So prereqs, you'll get to know about prereqs. I mean, overall, our major of health and exercise science is very prerequisite driven. And that's just because your knowledge base builds as you go from one class to the next. And so health promotion, I said you can get, a job right out of college with your bachelor's degree. You definitely don't have to go to graduate school. So there's health and fitness facilities. The clinical setting in a hospital, for example, is very popular. The cardiac area, the pulmonary or cancer rehabilitation. Corporate health, a lot of big businesses have pretty nice fitness wellness facilities on site, and you could possibly be the manager of those. You could also be a manager of a rec center. And there's all sorts of programming that goes along with that. So a lot of different graduate school options you can consider outside of the obvious health related ones would be public health, maybe counseling or exercise physiology. So those are just a few. I'm going to go to the next slide, Sadie, because you talked a little bit about taking some courses while you're still in high school concurrent. So what we've got here is, this is a snapshot of the first 2 years of the curriculum. And the big circle, those are all the common classes that both concentrations have to take. So that tells me that you don't have to worry about deciding your first 2 years what concentration you want. You don't have to know day one when you come to orientation, oh, I definitely want sports med or I want health promotion, because there's a lot of common classes. And the ones listed in purple, so math and comp, those are really important to get done in your first year, just because math becomes a prereq. And everything you see in red, math is a prerequisite for it. So kudos to you for taking a math class while you're still in high school. There are 3 credits of math that are required. So Math 118 is actually Algebra 2. Math 124 is the exponential functions. And then Math 125 is trigonometry. So those 3 classes are each 1 credit. So that's 3 credits of math. Everybody needs 3 credits of math. And then Comp 150 is a 3 credit class as well, which definitely could be taken, at a community college or a 4-year university. And we could probably even look that up for you and tell you the equivalents, because we have this really cool program called Transferology, which is a big database that lists equivalents. So if you're interested in knowing those, we can help you with that. So some other common classes in the big circle, you're going to get to know what all these acronyms mean. Life is actually biology class. PSY is psychology, obviously. HES, well, that's health and exercise science. So a lot of times we refer to us, we're an HES. HES, we're always saying that. So HES just stands for health and exercise science. Chemistry, some of them are kind of obvious. Status, statistics. And then those 2 outside circles, so those are different classes. So if you're going the health promotion route, you take an economics class. Whereas if you're going sports medicine route, you're going to take more chemistry. The next slide, the 2 big circles, now we get different. So those are differences. So you can see that sports medicine, when I was talking about, it's a lot of big science, physics, chemistry, another upper level nutrition class. BMS stands for biomedical sciences. That's the human gross anatomy class where you work with cadavers. And then I referenced some guided electives. Health promotion, a couple marketing classes built in there. And then those other HES classes, a couple of those are practicum, and 1 is the internship. So you'll get to know what all those numbers mean, and letters are acronyms. The small circle in the middle, those are the same classes. So the little circle, both concentrations have to take a comp class, another comp class, I should say. This one's called Writing in the Discipline of Science. You all take a theory of health behavior class, exercise prescription, exercise physiology. So yeah, that's just kind of a rundown of our curriculum. So I'm going to stop screen sharing right now and probably stop recording.